hi classmates! Ang napunta po sa amin na topic is urolithiasis, or also known as nephrolithiasis or renal calculi. Nephro means kidney and lithiasis means stones. So pag pinagsama po natin yung dalawang word na yun, it means kidney stones. And this will occurs when the stones exit the renal pelvis and move into the remainder of the urinary collecting system, which includes the ureter, bladder, and urethra. Also, it may develop in one or both kidneys.
Its prevalence is rising and primarily affects the working age population. Men presents more commonly than women, which is 10.6% versus 7.1%. Obese and overweight individuals present more commonly, and studies showed that obesity was an equalizer in the formation of kidney stones when comparing men to women. Variations between different ethnicities have also been seen. However, white, non-Hispanic males have the highest prevalence per recent studies, followed by Hispanic and then Black non-Hispanic individuals.
Kidney stones form when your urine contains more crystal-forming substances, such as calcium, oxalate, and uric acid, than the fluid in your urine can dilute. At the same time, your urine may lack substances that prevent crystals from sticking together, creating an ideal environment for the kidney stones to form. Kidney stones often have no definite single cause, although there are several factors that may increase of having it. So here are the risk factors that causes kidney stones. Number 1 is diet. Eating a diet that is high in protein, sodium, and sugar may increase your risk of some types of kidney stones. This is especially true with a high sodium diet. Too much salt is in your diet increases the amount of calcium your kidney must filter and significantly increases your risk of having a kidney stones. Also, it includes the poor oral intake or not drinking enough water, because low fluid intake leads to reduced diuresis, resulting in concentrated urine.
Also, the factors that increase your risk of developing kidney stone include obesity or high body mass index. Large waist size and weight gain have been linked to an increase of kidney stone. Compared with non-obese adults with a BMI of 40 kg or higher had an increase of risk of diabetes, hypertension, and hyperlipidemia. These comorbidities have been shown to have some association with kidney stone formation and can elicit specific changes, not only systemic effects of the body but also particular body organs, and ultimately contributing to kidney stone formation. Also, some medical conditions such as renal tubular acidosis, because of these abnormal calcium deposits that build up in the kidneys. Cystinuria. Cystine stones are caused by a rare disorder called cystinuria. This disorder causes a natural substances, or called cystine, to leak into your urine. When there is too much cystine in the urine, kidney stones can form or formation. These stones can get stuck in the kidneys, bladders, or anywhere in the urinary tract. Hyperparathyroidism and repeated urinary tract infection also can increase your risk of kidney stone. Lastly, the certain supplements and medications such as vitamin C, dietary supplements, laxatives, calcium-based antacid, and certain medication used to treat migraines or depression, and it can increase your kidney stones. Thank you.
For the pathophysiology of urolithiasis, there are factors that can contribute to the formation of kidney stones. So this includes high protein diet, high salt intake, medications such as antacids, carbonic anhydrase inhibitor, vitamin D, and laxatives. Dehydration and obesity can also contribute to these factors. These risk factors will lead to a number of things. The first one is it will increase the urinary solute concentration, including the concentration of the calcium uric acid, calcium oxalate, and sodium. Some of these risk factors will also decrease the stone-forming inhibitor, which includes the citrate and magnesium. The increase in urinary solutes and the decrease in urinary stone inhibitors causes increase or urine supersaturation, which leads to urine crystal formation, or also known as urinary stone formation. A decrease in urinary volume, such as dehydration, and an excessive increase or decrease in urinary pH also contributes to urine supersaturation. So, in summary, the urine supersaturation with stone-forming salts results in crystal formation.
Crystal-like structures are essentially precipitants of some electrolytes that have accumulated there. This crystal is actually a urinary stone. If the crystal is small, it will just pass in the urine. But if it remains in the kidneys in the nephron, it can grow bigger and become a kidney stone. A kidney stone again is basically a big crystal. The kidney stone can lead to an obstruction. The obstruction within the tube can create a buildup of pressure in the tube. This pressure can cause irritation, and this irritation is read by the brain as renal colic. There is also an inflammatory process going on due to the obstruction, and this also leads to the renal colic. The pain we feel when there are urinary stones in the body, alternatively, the stones can lodge or get stuck within the ureter. Remember the sites of constriction of the ureter. The stones can get stuck there, and when this happens, irritation and pain can occur due to stretching of the fibers that are there, which are caused by the increase in pressure within the ureter. This increase in the pressure proximally to the site of obstruction and the irritation going on, edema can occur and the ureter will contract more vigorously, trying to push the stone out, and this is called hyperperistalsis. With this, the clinical presentation of kidney stones can include acute flank pain, which can radiate to the back or towards the groin, and the flanks there can be associated with fever because of the inflammation and nausea and vomiting. There can also be urinary frequency and urgency hematuria. This person may present to be obese. And that's all for our pathophysiology.
Diagnostic tests for kidney stones. First, we have the blood testing. The blood test result will show the health of your kidneys and will also help the doctor to show if you have any other medical conditions. Second, we have the urine testing. The urine test will show if the patient is excreting too much stone-forming minerals or excreting too few anti-stone-forming substances, which is oxalate. And lastly, the imaging test. The imaging test is used to show if the patient has kidney stones present in their urinary tract. First, we have the CT scan that will show even the smallest stones. The ultrasound is also an imaging option for kidney stone diagnosing. Last, we have the abdominal X-ray. However, it is less frequently used because it will not show even the smallest kidney stone.
Now, we can already proceed to the clinical manifestation of the disease. A kidney stone usually will not cause symptoms until it moves around within the kidney or passes into one of the ureters. So as we all know, the ureters are the tubes that connects the kidney and the bladder. And if a kidney stone becomes lodged in the ureters, it may block the flow of urine and cause the kidney to swell and the ureter to spasm, which can be very painful, and at that point, you may experience these symptoms. So these are the following symptoms. Number 1, pain in the back, belly, or side. Usually, the pain starts when a stone moves into the narrow ureter. This causes a blockage, which causes pressure to build up in the kidney. And number 2, we have here pain or burning during urination. Once the stone reaches the junction between your ureter and bladder, you'll start to feel pain when you urinate, or what we call the dysuria.
Blood in the urine.
Blood in the urine is a common symptom in people with kidney stones. This symptom is also called hematuria. The blood can be red, pink, or brown. Next is cloudy or smelly urine. Healthy urine is clear and doesn't have a strong odor. Cloudy or foul-smelling urine could be a sign of an infection in your kidneys or another part of your urinary tract. One 2021 study found that about 16% of people with acute kidney stones had a UTI. Next is nausea and vomiting. It's common for people with kidney stones to have nausea and vomiting, and these symptoms happen because of shared nerve connections between the kidneys and the GI tract. Stone in the kidneys can trigger nerves in the GI tract, setting up an upset stomach. And last is fever and chills. Fever and chills are signs of an infection in your kidney or another part of your urinary tract. This can be a serious complication of a kidney stone.
As for nursing intervention, our nursing priorities, of course, is to alleviate the patient's pain, to maintain adequate renal function, and to prevent any complications, and to provide information about disease process, prognosis, and treatment needs. Generally, once the stone has passed, the pain is relieved. Unless the patient is vomiting or has heart failure or any other condition requiring fluid restrictions, fluid is encouraged. This increases the hydrostatic pressure behind the stone and it assisted in its downward passage. A high round-the-clock fluid intake reduces the concentration of urinary crystalloids, dilutes the urine, and ensures a high urine output.
So let's proceed to the medical management. The goal of management are to eradicate the stone, determine the stone type, prevent nephron destruction, control infection, and relieve any obstruction that may be present. The immediate objective of treatment of renal or ureteral colic is to relieve the pain until its cause can be eliminated. Opioid analgesic agents are given to prevent shock and syncope that may result from the excruciating pain. Non-steroids anti-inflammatory drugs are effective in treatment renal calculus pain because they provide specific pain relief. They also inhibit the synthesis of prostaglandin E, reducing swelling and facilitating passage of the stone.
No proof is not enough. She's a
Also, the factors that increase your risk of developing kidney stone include obesity.